Eastern Melbourne Medicare Local covers the local government areas of Knox, Maroondah and Yarra Ranges. We service a population in urban areas, in peri-urban areas and rural areas, and we have a population of over 400,000 people. The last financial year has been our first year of operations at Eastern Melbourne Medicare Local. It's been a really exciting time for all of us working in this area. Lots of new things, lots of exciting challenges for us to face. In 2012-13, Eastern Melbourne Medicare Local provided over 35,000 individual patient services. We have 426 GPs working in our region, 103 general practices, and this year we held 46 education events, 18 of those specifically for general practitioners. Among these events, some real highlights were adult and paediatric fracture management events, mental health and e-health. We've also begun work this year on Health Pathways, which is a really exciting new project designed to improve patient care from the general practice end into the acute sector. This year we also undertook a detailed needs assessment of our population. We looked at the data for the region, we interviewed people locally and we talked to the services who were already providing care in the region. The aim was to determine what the real needs of our population were, and we came out with a number of really specific priorities for our people. Some of those priorities included things like chronic disease management and prevention, aged care, mental health and eating disorders. Late this year we released a really important piece of national research that we'd done looking at people's experience of the health system, but particularly in light of the Australian Charter of Healthcare Rights and whether or not those rights were being met under our current system. The research was undertaken by Crosby Textor and it looked at a range of issues that are going to help us with future forward planning. We wanted to have a really close look at the health issues that were worrying Australians, how they were accessing the health system and what were the barriers to that access. We also wanted to know how people were receiving their information about healthcare and what they understood about chronic disease. We used the research to explore the relationships that people held with their GPs, and what it told us was that Australian GPs are held in enormously high regard by their patients. The research also helped us to understand why people fail to access services and how we can assist them to become better patients. GPs are the cornerstone of our health system. This research is going to assist them to build on the excellent relationships they have with their patients to further improve our healthcare system. In partnership with Inspiro and Yarra Ranges Council, we offered a tertiary health scholarship this year to a young person to assist with the costs associated with their studies. What we hope is that in the longer term, this will encourage them to return to our area to practice in a health discipline. Eastern Melbourne Medicare Local was fortunate to win 2 national awards this year for our mental health services. The first was an award for clinical excellence and the second was an individual distinction award from HESTA for our Director of Health Services, Craig Maloney. We're absolutely dedicated to our mental health services here at Eastern Melbourne Medicare Local. We have over 28 mental health nurses who work often co-located with general practices, with schools, with community organisations to deliver mental health services for some of the most vulnerable members of our communities. Partnerships are really important here in the health sector and we consider ourselves to be part of the backbone of the health services in our region. This year we've been fortunate to form a number of really special partnerships, and one in particular was around the development of a Headspace site at Knox Ozone. Headspace is a really unique service platform and it's a new service entirely for young people out here in the cities of Knox, Maroondah and the Shire of Yarra Ranges. It effectively brings together a range of service providers in one location to wrap care around that young person specific to their needs. It looks after mental health, physical health, drug and alcohol requirements. It actually looks at employment and housing and a range of services that young person might need at that particular time in their life. Partners in Recovery is another really exciting initiative that we're rolling out at Eastern Melbourne Medicare Local. It's over $8 million worth of funding into our region and it's specifically designed to assist those people with severe and persistent mental illness who often fall through the gaps in our service system. What we did was work with a really core and wonderful consortia group to set up a plan for how we would deliver this service in the initial phase, and then also look at how we would realign the system so it would actually better meet the needs of those clients in an ongoing way. We've actually made a partnership with Mind Australia to deliver the service, and we currently have clients in the system. We are the first Medicare Local in Victoria to be seeing clients. Partners in recovery services include drug and alcohol services, housing, homelessness services, employment, education, emergency services, and engagement with hospital emergency departments. As part of our needs assessment processes, we identified there was an enormous gap in treatment options for people suffering from eating disorders in our region. So what we did was we worked in partnership with Knox Community Health Service and the Butterfly Foundation to develop an innovative new program that we call PEACH. PEACH stands for Positive Eating and Changing Habits, and it's a first of its kind in Australia, a service that works in primary care and in the community to assist people on a recovery journey whilst they continue living at home and going to work. PEACH is an intensive outpatient model of care. It allows the patient or the client to work in with their general practitioner, with a dietitian and with a mental health nurse on their recovery journey. The unique part about it is that it's an intensive treatment model, but it still allows the person to stay engaged with their everyday life. The federal government's Closing the Gap initiative aims to close the gap in life expectancy between Aboriginal and non-Aboriginal Australians. We have almost 2,000 people living in our region who have identified themselves as either Aboriginal or Torres Strait Islander. We began the Care Coordination and Supplementary Services program in April of this year, and we deliver the program in partnership with Knox Community Health Service, Yarra Valley Community Health Service and Each Social and Community Health. The program aims to improve the health of Aboriginal people living in our region who are experiencing one or more chronic conditions, including diabetes, cardiovascular diseases, respiratory conditions, kidney disease and cancer. The program has provided better care coordination, assistance with purchase of medical aids and transport to and from medical appointments.
Key aspect is to help the Aboriginal community access the services they need. It's all about trying to close the gap in life expectancy between Aboriginal people and the rest of the population. Over 90% of Victorian Aboriginal people have experienced some sort of racism in the last year. 70% have experienced more than 8 episodes of racism. So people are actually afraid of attending mainstream services still. That's why we've been working so hard here to make this a friendly place for people. We've run health check days here, so that's a way where it's kind of one-stop shop, but very informally people can come and we put on a meal and they can quickly sort of see a physio and a podiatrist. Particularly things like dental. A lot of people are embarrassed about the state of their mouth, so it's a big deal for them to actually make an appointment. And where possible, we make everything free. We also make it priority access. The end aim is to address chronic illness, but I will always sort of look at issues like housing or legal issues, or someone's having trouble with their kid in school, or you look at everything because people aren't going to worry about their health if they're worried about their kids, or they're worried about where they're going to live. So you have to have that holistic sort of approach.
eHealth has been a major platform for Eastern Melbourne Medicare Local this year. Our team's been out there assisting general practices to register for the initiative themselves and also to register their patients to sign up for a personally controlled electronic health record. Our team have been out there in supermarkets, in malls, at schools, assisting people to understand the process, what it will mean and how it will actually change their interactions with their doctor and the health system more broadly. We've been recording patient experiences this year. For us, it's been about trying to capture how people have experienced the system and to show that in a way that others can learn from that experience. Leslie McVean was our first patient story that we've actually published. Leslie's story is a really moving story. It's the experience of her husband Ned and his diabetes, and although the story itself doesn't have a positive ending, she's got an enormous amount to tell us and teach us about about the experiences herself and Ned had within the system. Patient stories are rarely new to general practitioners. Most of them will have heard a story like Leslie's story many times before, sometimes all in the same day. But it gives them that chance to reflect and to see how their work actually intersects with other people's work and how the system as a whole could work better for people like Leslie. The LIFE program's a preventative program aiming to improve people's understanding of their lifestyle habits and effectively stop them from going into chronic illness. It aims to reduce the risk factors for diabetes, heart disease and stroke. This year, 226 people participated in our LIFE program.
Well, we did a workplace health check, and after doing that they advised I was at high risk of developing diabetes. They sort of said, well, you can be referred onto a program if you wish, no charge, etc. And I thought, well, why not? You don't quite realise how much of the bad foods you're eating until you sort of sit down, and part of the program was to give details on how often would you eat, such and such foods. When it's down on paper, you sort of really start to be able to see what you're doing to yourself. So I dropped about sort of 24 kilos up to today, gone down 3 sizes in my pants, and just overall reduced my body fat and feeling a lot better for it. Small changes will make a difference.
In response to an identified need for after-hours services in one of our communities, we implemented a pilot program around having a visiting GP go to aged care facilities to assist those residents who may not have been otherwise able to access their regular GP. We had 7 aged care facilities in the Shire of Yarra Ranges participate in the pilot program, and we did show at the end of that we reduced the number of people who would otherwise have had to go via ambulance to a hospital.
This year, the Melbourne Medicare Local ran a pilot project for after-hours coverage for aged care facilities to try and work out whether there was a gap in services for those facilities in terms of access to medical care after hours. There were about 4 or 5 GPs involved in the project, and the hours that were covered were from close of business hours on weeknights to 10 o'clock at night, and then from 2 till 6 on weekend afternoons. I myself worked on Saturday afternoons because I knew that working in the evenings after a long day at work would be very tiring, and I think this is one of the challenges of maintaining effective after-hour services, particularly in rural areas. The best thing about the project, I think, was working with the staff and also alleviating distress in the patients or for the patients' relatives. It could save them going to an emergency department or waiting another couple of days, for instance, to have a chest infection treated, then by which time they could have got worse.
We'd particularly like to acknowledge the hard work of our Chair and Board of Directors, who put so much work into the guidance and direction of our organisation in the first year of our operations.